I'm Shanaya Rathod, consultant psychiatrist at Southern Health NHS Foundation Trust. I'm also a visiting professor at the University of Portsmouth. I'm a co-applicant in the EYE2 project and also the site lead for Southern Health for the project. But I also led, along with Phiri, I led on the work package on adaptation, cultural adaptation of the materials.
So my role really has been looking at what are the relevant key areas for consideration for cultural adaptations within the study material and resources, but also making sure that all the key areas that are pertinent to the framework were being considered, that we were asking relevant information to the study participants to elicit really the key areas that will be relevant for consideration for adaptations.
We absolutely need to ensure that whatever interventions we offer service users needs to be relevant. And culture plays a very important role in every aspect through the journey of somebody's mental health problems.
When something is relevant to people's cultural values and norms, it means that there's a buy-in into the intervention, but also because they are part of the intervention as people that have been involved in co-production, then they're more likely to use the intervention, but also to ensure that others as well.
I think EYE2 Project sets an amazing example of how every research project should include the adaptations to diverse populations right from the word go, right from when the project is being planned, rather than as an afterthought, as many projects tend to do. Not many research studies have a good representation of ethnic minority or diverse populations, and therefore the results do not reflect the evidence of these interventions for these populations.
It's making sure that the sensitivity with which the terms that we use, but also the concepts that we use align with people's beliefs and spirituality as well, because that is what, once again, something that will mean it's relevant, and also there's a buy-in from the communities as well.
It is really important to understand that this framework allows personalized care rather than put people in boxes around their cultures, and that's why it is so important that we use validated frameworks.
The other thing was that people wanted the materials to relate to the readers, which also included carers and families as well, because one of the questions was, well, if I'm reading this and my parents look at this, what will they think about that? Will that be something that they want to pick up and read as well? So they wanted not only just for the service users, but also for the families and carers, which was really key in ensuring that the materials were covering different groups of people, patients, the carers, and also healthcare professionals as well.
The materials are now more in tune in understanding and explaining that these are key factors so that everybody can relate to the materials.